This is Pet Life Radio. Let's talk pets.
All right. Good morning, good afternoon, wherever you may be on this here. It's a lovely Sunday morning. Guys, blue skies, it's great. So just here talking pets. Anything you want to talk about, now's the time. Here on Pet Life Radio, you can get a hold of me by, if you're here listening to me, you're probably already on the app. So therefore, all you got to do is click on the shows where you're there. Just type away. And if you have a picture or your pet with you, that's even better. As you know, I always say, picture's worth 1,000 words. A live video where I get to see you in action with your pet, that's worth 100,000 words. And if you are not, you can always get a hold of me, 877-385-8882. So if you are shy and you don't want to be seen on camera with me and your pet, you can always just pick up the phone, 877-385-8882. Here on Instagram, you're here already. I'm waving to you. If I miss some waves, type away. We definitely love the questions. Hello, Tammy. So I just talked to Joey. Tammy's my cousin. So a lot of good stuff going on and some really good things to talk about. Love your questions. So, thank you. So his birthday, huh? That's good. So a couple of things. First of all, I have to say, so as you know, maybe Friday and Wednesday are my shorter days, whatever that means. And so I, shorter, it's all relative. I book myself usually from like 10 to 1. That's my standard, 10 to 1. And then by the time calls coming in, I say, okay, well, I'm already booked solid, so I'll see you at 9:45. I come at 9:45. Next call comes in. Well, I go, before you know it, I'm there anyway from 9 o'clock. But Friday, there were so many walk-ins, and I have no idea how this happened, but when I walked in about 10 to 10, there were already 10 people waiting to see me, which is crazy. And then at one point, you know, me and my Frenchies, people thought it was like I was running a Frenchie special. At one point, there were 6 French bulldogs in the waiting room, all separate parents waiting to be seen. And people looking, okay, are they that popular? And I guess they are. But anyway, it was really, really fun. I must have seen, I don't know, 35, maybe even 40 cases. It was insane. I got out of there by after 5. So, but it was fun, a little stressful, but certainly fun. And it's really cool. And I'm going to post it, I hope today or tomorrow. I had a case come in. Wait till you see this. It's unbelievable. So it is a 12-year-old dog, comes in 60-something pounds with the history of a huge tumor. And the emergency doc recommended, based on the dog's age, the fact that she was really, really weak, that they should put her to sleep. And they did blood work. They sent me the blood. I said, let me see the blood work. So the packed cell volume, which is the percent of red blood cells circulating in the blood, again, the red cells carry oxygen to the tissues, was very low. Normal is 37 to 55%. You get down below 25%, you start worrying about anemia. 20%, really worried. By 15%, you're looking at 100% transfusion. And this dog was at 18. But interestingly, the rest of the bloods were actually pretty darn good. And the x-rays, you could see, and I'm going to share the x-rays, a humongous, it's a mass basically taking up the entire abdomen. There was no room for intestines pushing up against the stomach, which explains why the dog was vomiting. And I said, well, again, most likely, not that the dog read the book, but most likely there's going to be a splenic tumor. And if it's isolated to just the spleen, it can be removed. It's worth a try. Let's see what happens. So we got the permission. We were ideally would try to transfuse. No one locally had some blood for us, but we did the surgery. Surgery successful. Open this dog up. Wait till you see the spleen. This is a 6.5 pound tumor. It's bigger than a basketball, a pro-sized basketball, and way heavier. It's unbelievable. So anyway, of course, as with my last case, we talked about a couple of weeks ago, check the liver, totally clean. The intestines, totally clean. Well, we got to get this thing out and give this dog a chance. So anyway, here it is. We did this on Wednesday. So I already spoke to the owners this morning. The dog is starting to get up and walk around. It's starting to eat and drink. They're feeding it some broth and some, obviously, antibiotics and stuff like that. And this little old girl is, considering what she was carrying around in her abdomen is doing amazingly well. So these are the success stories that I love, because doing things like this, and truly, like I always say, look, I have no ego. The truth is, usually pets get well, this is generally for veterinarians, in spite of us, not because of us. And here was a case that I would have said, this is because of me. It's these hands that actually saved this dog's life, especially since the emergency doc wanted to put it to sleep. So, I mean, that's pretty amazing. And I don't know how much time we'll be able to give her. It's most likely going to be what's called hemangiosarcoma, which is a highly malignant tumor. It's going to spread. At this point, as I said, the liver, intestines, the abdomen is clear. The lungs, we took x-rays, of course, before surgery. Lungs were clear. So I have no idea. My crystal ball is gone. So I don't know, as I said, I can't tell. I mean, they say the low guesstimate would be 3 months, even with successful surgery, before it's going to spread. Others say it could be, I've had cases that went over a year and a half, actually. Dogs are 12. So if he gets to 13 and a half, and he's obviously a good-sized dog, that's great. So it's really, really something. Anyway, request. Beth, do you want me to give me a thumbs up if you want to request? Because last time I did this, you said, no, it was a mistake. So if you hit the wrong button, let me know. Give me another thumbs up if you want, and I'll accept the request. So, good. So, Del Doyle, my dog has bacterial yeast infection, or I guess ear, 2 types of drops, but having a hard time getting ear drops in. So, all right, let's talk about ear infection. So, first of all, ear infections, very, very, very common in dogs. I would say it's one of the more common things we see, and especially this time of year, which is allergy season. And there is a delicate balance in the ear between yeast and bacteria. And interestingly, they usually keep themselves in check. So in a normal, healthy ear, you might find some yeast bacteria, but they're about the same. They're controlling their own infection. However, when that balance is upset, usually it's the yeast winning out over the bacteria. And then we get these really disgusting ear infections. And it's pretty common. So I don't like using drops. And I'll tell you why. First of all, as you see, it's hard to do. Secondly, most ear medicines come with a long nozzle. So I want you to hear me out, because this is very important. Something I learned several years ago when I went to a conference on ears. Well, it was one of the talks at one of my conferences. And this guy was fantastic and made tons of sense. So much of the problem is down deep into the ear canal. So when you are holding the bottle up, all right, and you're counting drops, 5 drops, 7 drops, whatever it is, if you can count the drops, that means you're putting them above the entry point to the long vertical ear canal. And there's oftentimes debris there, and you're not getting to the root of the problem. So if you can count the drops, there's no guarantee that the drops are getting to where they are. Now, let's look at the other side of the coin. The coin is that long nozzle where you put down in the ear, okay, and you squeeze the bottle. How are you going to count the drops? You can't see the drops coming out. You have no idea how much you're delivering. So basically, I mean, this is so practical. It's crazy that 4 of us haven't been doing this from years ago. But in fact, one of my cousins is an ENT, human ENT. And what they started doing for kids is a little pump thing on the end of a long nozzle. So that instead of the instructions might be give 3 pumps. And they already knew how much medicine was delivered with each pump. And they were great. And I actually was testing it in the veterinary market. I thought it was a great idea. But of course, veterinarians didn't want to do it. And he gave up trying to market to veterinarians. Great idea. So here is the less expensive alternative, which makes tons of sense. So the little 1 cc syringes we use, like insulin syringes called tuberculin syringes, are very skinny. So what this guy says is use the correct medication, but instead of drops or instead of squeezing, which you can't count anything, what you do is you put in a measured amount of medication, starting with a small dog might get 0.2 to 0.3 ml, all right, which might be 4 or 5 drops, up to a big dog might get 0.8 of a cc, or maybe a huge dog like a giant breed might get a full ml. And now you fill your syringe. Now you put the syringe down in the canal as you would the long applicator tip. And now you push down on that. So now you know exactly how much you're delivering. And because you're putting it down into the ear, you're delivering the correct amount. So what I would recommend doing, depending on how large your dog is, and I don't know why you need 2 drops. I would like to know, if you can, 3 drops. 3 drops, whatever it is. If you can count the drops, you can see the drops. So give me the 2 types of drops, because most of the ear drops that we use are a combination of antibacterial, antifungal, and antibacterial. So therefore, you should only need 1. So I'm very curious to know what was being given, and then also how many drops. I need to know the size of your dog. Once I have that, then I will help you determine how many mLs, and you should ask your doctor for a couple of tuberculin syringes. After you use them, by the way, just by practicality, rinse them really well, and don't let them dry with the plunger already pushed in. Keep the plunger out to let it dry, because that rubber tip at the end of the plunger will often get stick inside the actual syringe, and you won't be able to use it anymore. So anyway, that would help me. Tell out of place, 5-year-old. Let's go to that in a minute. I think there was another one coming in. No. Hey, Josh. Right. So tell out of place, degenerative, my dog is 5 years old. So here's the thing. When it comes to patella luxation, there are 4 grades, grade 1, 2, 3, and 4. And also we see this more commonly in small breeds, the very small breeds, but we can see it in any dog. But typically it's the small dogs, the Papillons, the Pomeranians, the Maltese, the Yorkies, the little mini poodles, Pomeranian, all those. They're the ones that you typically have MPL, medial patella luxation. So grade 1, picture this. First of all, I'll kind of show you. If you looked at your knuckles here, the space between the knuckles, this is much shallower than this. The kneecap, the patella, sits right in that femoral or patellar groove, and it is attached. It starts with the patellar tendon coming from the muscle group, the quads, all right? And then it rides over the patella, and then the patella becomes a patellar ligament, and that inserts on the tibial crest. And normally from the quadriceps muscle group through the knee, femoral groove, to the tibial crest where it inserts, it's usually a straight line. Think of a crease coming down the center of your slacks. Okay. Now, in these small dogs, a couple of things are in error, things that are abnormal. Number 1, the patellar groove is usually shallower, and the wall on the medial aspect is shorter than the wall. Okay. So this wall is shorter than this wall. So the tendency now of the patella is to slip off. Also, what we have is the insertion. The tibial crest is usually anatomically more medial. So the pull now comes straight down from the quad group and then instead of going straight down, it cuts inside medially, thus pulling the patellar off. Okay, now that's the anatomy. So we have 4 grades. Grade 1, the patellar is usually in the groove. It can be pushed off, right, manually with a relaxed knee, and then it pops right back on. Nothing to do. Don't worry about it. That's a grade 1. Grade 2. Grade 2 is when you push it off the groove, and meaning the doctor testing it, it might stay out for a couple of steps, but it spends most of its time in the groove. Again, most of us would say you don't have to do surgery on that. Now, grade 3. Grade 3 is when it's actually spending way more time outside the groove. It could still be reduced. I could still push it back in the groove, but as soon as I let go, it pops back on its own. That's a grade 3. That's surgery. And grade 4, it's been out of that groove so long, it forms a false joint just medial to the groove, and you cannot move it. That's 100% surgery. So other criteria to do surgery is there arthritis that is progressing? Because if so, then yes, you want to ideally have surgery. It helps them with their gait, but it also will help slow down the progression of the arthritis. And the surgery is a 2-fold, 3-fold. Number 1, of course, we need to deepen the groove. Then we need to transpose. We have to move that tibial crest over laterally so it sits directly under the quadriceps muscle group. So it doesn't have that natural pull anymore to want to pull that kneecap medially outside of the groove. And lastly, a joint imbrication, just basically tightening up the joint capsule over the newly corrected, and that'll also help keep the kneecap in place. It is a surgery that is most times very successful, usually done by a surgeon, a board-certified surgeon. I don't do that surgery. I have one of my boarded surgeons come in and do it, but these dogs do really, really well. So if it's out of place most of the time, you're going to have a degenerative joint disease, DJD. Therefore, I would recommend 5 years old. If it's a grade 2.5, 3 or 4, 3, especially a 3 or 4, it should be fixed. Okay, with that, Lexi, we're going into our break. I'll stay here during the break on my Instagram, here on Pet Life Radio. Don't go away. Come right back after the break and get here some questions. I'm sure you must have questions, things you want to talk about, because everybody can share this and everybody wins. It's a big benefit to all. So we'll be right back after these short messages. Do not go away.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms. And our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets
Let's talk pets
on Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
All right, so we're back here. We're talking about collapsing trachea. You got to hear this because it's very common in the very small breeds. Again, it's the Pomeranians, it's the Yorkies, it's the Maltese, it's the Poodles, the Maltipoos, all these. And they'll get something where their trachea collapses. It's weaker tracheal rings or a redundant dorsal tracheal membrane. And you hear them. They go through these fits and you could see they're stressed. And they tried all sorts of things. And they've tried to put stents inside. When the stents expand, it puts too much pressure on the wall of the trachea, and the trachea wall blood supply is constricted, and the tissue dies. Disaster. They've tried to stuff on the outside, and they just attach like a thing on the outside. Again, the suture points. Disaster. It is such a sensitive tissue. Nothing's really worked. I was telling a story of one of my former technicians, went on to veterinary school at UC Davis, did a surgical residency, coming out of became a board certified surgeon. And when she graduated, started working on some techniques for tracheal collapse surgery. And I talked to her, I don't know, a year and a half later to see how she's doing. And I said, so what happened? How you been success with that new technique? She goes, candid, it just didn't work. It's really, really a tough thing to say. Now, the good news is it sounds worse than it is in the vast majority of cases. Now, I'm in my 40th year of doing this, and I've had 2, maybe 3 dogs in those 40 years of seeing hundreds with tracheal collapse that ultimately died or were put to sleep because of the tracheal collapse. So sounds terrible. It stresses us to hear it. It stresses them to have it happen, but it's usually not deadly. I would say anything you do to keep them calm. So any calming, the Hycodan syrup, also, it's a cough suppressant. It does keep them calm. Make sure there's no infection. It's usually worse early morning and late night, just like a tracheitis, a kennel cough. And it is what it is. I think keeping them really calm, because when it starts and they feel this problem, they have breathing, they try harder to breathe. The harder they try, the more problems. So anyway, that's kind of what it is. Okay, a 42-pound lab terrier mixed with ear. So I would say, I need to know what 2 medications. My hunch is there is 1 medication that you can get away with. And I also want to get to this heart murmur. So Amon, did you tell me why the caudal abdominal surgery? I need to know that. Male cat with Down's kidney disease, like in renal food. So yeah, I need to know what was the surgery, because that will explain things. Most surgeries done in the caudal abdomen are going to be bladder surgeries. And you do a bladder surgery because of stones. And stones can cause blockage. And the blockage, you get this backup. Okay, Momentum-X. Okay, that's good. If it's only the Momentum-X, that's a great medication that takes care of both. I got 6 different conversations going at the same time. Let me finish real quick with the renal. So, and my miconazole, you shouldn't need, unless my miconazole oral. If it's in the ear, Momentum-X has an antifungal. So I don't know if you need both. So, 70 pounds. Which one was 42? So let's go back. I was mixing up all these dogs here. So if it's 70 pounds, then I would use 0.8 ml, get some tuberculin syringes of the Momentum-X. And that way you put the syringe down as deep as you can in the ear. Maybe, it doesn't need that much, just so where you pass most of the longitudinal canal, and then you put the whole thing in the ear, the syringe. That way you're delivering the correct amount and you're getting it in the right place. when you're counting drops and you got that thing up here and the ear canal is here and you're going 1, 2, 3, 4, no wonder it's not working because it's not getting to where it needs to get. So, and also always start with cleaning the ear really well first, because what you don't want is you don't want to have the drops going on top of all the debris. You got to get the debris out. So as far as the renal disease, maybe there was something. I'm surprised they did a surgery without knowing what they were doing surgery for. And if it was just kidney, it's hard for me to see. I didn't see the x-rays. I didn't see the ultrasound, so I can't comment. But it does seem strange just to open it up, look, see just fat. They said they saw something on his abdomen. What did they do after the surgery? Did they remove anything? But let's say it was something real and it was putting pressure on the bladder. There was a backup of urine coming from the kidneys into the bladder, but then it couldn't get all, so it was putting back pressure on the kidneys. That would raise the enzymes. Now that whatever it is resolved, now everything's working fine. So I would have no hesitation if the kidneys are fine. Now, do we know that the kidneys are fine because of the renal diet? And therefore, to stop the renal diet, might you be opening up a can of worms and they'll get bad again? It's a tough question. So, you can try, I'll tell you what you can do is sort of a compromise. Oh, it's a cat. It's a cat, 6-year-old cat. Well, look, we know that cats have a tendency to having kidney disease. So I would be one of the glass half full, hopeful that the reason why the kidney values are good now are because of the diet. And if that's the case, and we know that cats have a tendency to get kidney disease, then my recommendation is if it ain't broke, don't fix it. If you are on a good diet and renal diets are good and the cat's doing well and the values are back to normal, be thankful and just keep on, as long as the cat likes it, keep feeding that diet. That would probably be the smartest thing to do. I don't know if I want to run the risk of taking them off only to find out that the reason why the kidneys were doing better was because of the diet. And now you're back to square one and you may not get the same success rate once the kidneys get bad again. So, okay. So that's my thought on that. Now let's talk the ears. So you're going to go in. I would hold off on the Momentic Max for now. Get the syringe for a big 70-pound dog, about 0.8 cc's. It's what I would recommend for one of my 70-pound patients. Of course, I can't tell you exactly what to do, but that's what I would recommend to one of my patients or my clients, actually. Of course, I would tell my patient if you listen to me, but my patients never listen to me. So where else was there was another good question? Okay, right. And I agree. An orthopedic specialist did not recommend surgery. So if he's 1 or 2, then I would totally agree. Heart murmur. What can you do for heart murmur? Loaded question you're asking me. So first of all, as with these different grades, there are 6 grades of heart murmurs and all based on how loud, how prominent the murmurs are. A grade 1, 2, 3, 4, 5, and 6. Now, grade 1 and 2, if there's no clinical disease, everything is normal on the animal, then I would just watch it. If there's coughing, at grade 3, if it's a loud enough murmur, and maybe you start noticing some exercise intolerance, maybe there's some coughing, then I would highly recommend electrocardiogram to start, but better yet, an echocardiogram. Seems like the EKG or ECG, electrocardiogram, and the X-ray is being replaced, rightly so, by the echocardiogram. Because those, you really can't, when you do an ultrasound, EKG, you are getting the electrical activity and that's about it. Yes, there are certain things we see with the larger chambers and how it makes changes on the EKG. You get to see more rhythm disturbances on the EKG than you can actually how the heart is functioning as an organ. Then the X-ray can just give you the size. Now, when you see a large heart, how much, for example, of that large ventricle is wall versus how much is chamber? Can't tell on an X-ray, but you can on an ultrasound, a cardiac ultrasound or an echocardiogram. You can actually measure pressures going in and out through the valves. You can look at the valve leaflets. You can see if there's any deposits of calcium on the leaflet. You can see if they're closing properly. You can look at the pulmonary artery pressure. You can look at the strength of the contraction of the ventricle, how much of the chambers are wall and how much are chamber itself. So there's so much more you can tell. Plus, an EKG is being done while that's why I call it an echocardiogram. You're doing both. So it is much more effective as a diagnostic tool. It is highly recommended, mostly done by board-certified veterinary cardiologists. However, I do know some general practitioners that have taken courses and could do an echo, but I have a cardiologist come into my office. We have them do the echo. It's expensive, but it's very worth it. You get what you pay for because it is so much more accurate as far as diagnosing a problem. And knowing what's best to use to treat the problem. So if the murmur is either greater than a 2, meaning 3, 4, 5, 6, by the way, 6, that's bad news. You can usually feel it. All right. A 5 and 6, you can maybe feel, but you can put up your ear against the chest and you can hear it. You can actually hear the murmur without a stethoscope. That's a problem. And with those, I'm imagining you're going to see a large heart on x-ray. Or if there's clinical signs. Clinical signs, the most common things we see first are exercise intolerance and coughing. If that happens, then yes, I would recommend the echocardiogram. All right. I think we got to everything. All right. So there you have it. If you have any questions, you want to reach out to me anytime during the week, you can reach out to me here on Instagram. You can send me a message. All right. And here on Pet Life Radio, send me questions during the week, either to Dr. Jeff at PetLifeRadio.com. Just send them to Pet Life Radio and Mark will forward them to me. These questions are great because it gives me a lot of things to talk about on our next show. And of course, not that I have trouble talking, but except for my voice, but other than that. And but I'll be for those, I'll be back. I'm going away tomorrow. I'm going to do something I haven't done in probably close to 40 years. And my good friend has a cabin up on the lake in Lake Arrowhead. So me and a couple of guys are going up for a day and a half. I pulled out my ski, which I think I used for the last time before this in vet school. So going on a lake, hope to have some fun. I'm hoping it's like riding a bike. You just don't forget how to do it. But I do snowboarding, so I'm probably going to remember. And I used to do a lot of skiing. So anyway, we'll let you know. We'll report next week and how much, hopefully, fun it was up on the lake. Questions, send them to me. Have a great week, everybody. And hopefully we'll be here same bad time, same bad channel next week here on Pet Life Radio. Once again, thanks to Mark, our producer. And we'll see you soon. Bye.
Let's Talk Pets every week on demand, only on PetLifeRadio.com.